Hello everyone, today in our series of Docplexus KOL interviews, we have with us Dr. Ramesh. He is the Senior Professor and Head of the Department of Urology and Renal Transplantation at M.S.Ramaiah Hospitals. He is also the Honorary Secretary of the Urology Society of India. He is the recipient of Chakravarti Travelling Fellowship by Indian American Urologic Association. Thank you so much, Dr. Ramesh, for joining us today.
Thank you, it's a pleasure being here.
So can you please tell us about the effective approaches in the management of overactive urinary bladder?
Oh yeah, I think the primary goals on management of overactive bladder is to see that the patient gets an overall response to his symptoms, his or her symptoms. So essentially we need to do a lot of lifestyle modification, look at the amount of fluids that the patient is consuming, and then also discuss with the patient the expected goals of the treatment that we are going to offer. Somebody who is going to be bedridden, who is going to be a diabetic, their goals of expectation of treatment is going to be different from somebody who is ambulant and having a normal work pattern. So based on that, we need to titrate the treatment modules depending on all these issues. So one of the primary goals will be taking note of how much fluid the patient consumes and looking at the urine output in a given day. And if the whole overactive bladder symptom complex is just because of increased output of fluid or diuretics or caffeinated products, then we need to regulate the input of these fluids. And then besides that, we also need to look at the cause of the overactive bladder. So the amount of investigations that we do is going to be dependent on the symptoms that the patient has. So if it's a straightforward clinical scenario, then you don't need too much of investigations like urodynamics. So you can straight away start them with treatment with antimuscarinic agents, of course after appropriate evaluation. So the mainstay in the treatment is going to be with antimuscarinic, with regulated fluid management and antimuscarinic agents.
So how does a physician decide between dialysis and renal transplantation, and does patient-specific factors play a major role in this?
Yes, patient-specific factors does play a role. For example, somebody who is having a productive life, say somebody who is at 40s, 50s or even at the age of 30, by doing a transplantation, the quality of life is going to improve. So I would prefer, because he's going to have a longer life, so I would prefer somebody at 20 or 30 to undergo a transplantation rather than go to a hospital for dialysis 3 times a week. Because dialysis, you need to take the patient, somebody has to be with the patient, so it takes away the work style or the man hours of 2 people. So I would prefer to do a transplantation rather than doing a maintenance hemodialysis. However, if the patient is elderly, beyond 65, you don't want to offer transplantation to somebody at that age because you don't know how long he's going to survive after 65. The expected age in India today is around 67. So somebody at 65, 67, it's better he's on maintenance hemodialysis rather than transplant. Besides this age criteria, we should also look at the other comorbid condition. If he's got a bad heart or bad lungs or bad liver, then it might not be worthwhile doing a kidney transplant on these patients.
So what are the different tools for early diagnosis of renal impairment?
One would look at the symptoms. Most of these patients are fluid logged, they have edema, they have tiredness, they are anemic. So the prime test that one is going to do is to do a blood chemistry to look at the serum creatinine and blood urea, and also do an ultrasound evaluation to see that if it's a medical renal disease or something that is correctable.
So Dr. Ramesh, what is the current status of regenerative pharmacology in the treatment of urinary incontinence?
This is still experimental regenerative pharmacology. As of now in India, it doesn't have a major role. Even in the Western world, it is still in the experimental stage. So we just need to wait and watch how it progresses.
So, since you are the Secretary of USI and this is the Golden Jubilee event of the USICON 2017, so what are your views on this?
Oh, it's been a great meeting so far. We are into the last day now, and the attendance has been the highest we have had so far in so many years. The arrangements have been excellent, and the scientific content is what everybody is looking at, and it's very pleasing that everybody is happy about the scientific content.
Definitely, it's a very good conference.
Absolutely.
So, what are your views on an online platform like Docplexus? Can it help spread awareness?
It is. It's a great platform because it can take into account the views of different professionals, either in the same branch, or I might want to look at professionals from other branch. So it's a great platform where we can meet and share views on a particular area.
Thank you so much, Dr. Ramesh, for sharing your valuable time with us in your busy schedule.
Thank you.
Thank you. To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!